Broadcasting from the campus of Salisbury University, this is WSDL Ocean City, NPR News Talk 90.7, putting Delmarva first. It's time for Delmarva Today with your host, Don Rush.
Heroin use has exploded on Delmarva. We'll take a look at the impact and what's to be done. Welcome to Delmarva Today. This is Don Rush. In Maryland, there was a 33% increase in drug overdose deaths for the first quarter of this year. And of the 252 total drug overdose deaths, 148 were related to heroin. In Delaware, heroin sales have significantly spiked since late 2010. Delaware State Police say in 2011 there were 500 heroin-related investigations. By 2012, it had doubled to 1,000 and was still climbing by last year. Authorities say the new heroin is more pure and can be ingested through the nose instead of being injected or smoked. While the state authorities have struggled with the new rise of the drug, there is a group called AtTAck Addiction. In our studio, our guests are Donald Keister and his wife, Jeannie, along with their daughter, Courtney, and they founded the group. They lost their son, Tyler, in 2012, at the age of 24, to a heroin overdose, and they are, of course, the founders of this group, AtTAck Addiction. Welcome, first of all, to the program.
Thank you.
And my condolences, certainly, on the loss of your son. I want to actually turn to your son first to give some human sense to this, because there are a lot of images about who junkies are, quote unquote, people who use. And I want to begin with what was he like? I mean, as a kid, what can you describe who he was? Before all of this happened.
Yeah, Mom can probably do a little bit better job. But
yeah.
Well, he was just your typical typical neighborhood kid. He was athletic. He was very smart. He didn't work very hard in school, but he was very smart and was an honor roll student. He just was real popular, funny, witty, and he went to a private high school, played football, and they were state champion football team. So he was athletic, and he's very proud of that. And it's not who you think it's going to happen to.
he was the all-American kid, and I think that's really what we're finding. The demographics of this problem. It's not what you usually see with living under a bridge or out on the street. It's it's some of the higher price suburban areas, home areas that this is affecting, and it affects everyone. But it's no longer in the inner city and in those areas.
Courtney, tell me a little bit about what you remember from your brother growing up with him.
Well, yeah, he was quite a character, very witty, as my mom had mentioned, and very kind to everyone around him as well. A little ornery sometimes, as little brothers can be, but yeah, he was great. Always was thinking about others. Didn't always apply himself, as my mom had said, to his highest potential, but, that's very typical of a lot of teenagers. But I think that they really described him well. Very athletic, smart. He really had the whole package. Anything that he wanted, he could have had.
So when did you get a sense that something was awry? Donald?
Well, during high school, we were aware that he was experimenting, and statistics show that 8 out of 10 do experiment in high school. It's a choice to experiment, but after he graduated from high school and spent a semester at Wesley College and didn't go to classes, he partied the whole semester, and he was gone by the end of that time. He got a job, worked for a while, but soon realized he needed help. And we got on the computer, and he found a place in Colorado that he wanted to go to seek help and try to get clean. He went to Colorado, stayed there for a year and a half, got himself clean, had a job, was living on his own, doing very well. He got a little homesick, decided to come back, and different relapses caused throughout the next 2 or 3 years, and until he succumbed to an overdose.
When did you get a sense that this had moved from, say, simple experimentation, which a lot of people do throughout their entire lives, to heroin, which is when people think about heroin, that's a giant leap from, say, smoking marijuana, for example, in terms of how people look at it.
Well, I think what you have to realize is that they take on these pills, these opiate pills, and they're every bit as strong and sometimes even stronger than heroin. And what occurs is they steal these pills from their relatives, grandparents, or what have you, and once they once they can't afford the pills anymore, the heroin is very cheap compared and very easy to get. It's one of the ways they move to the heroin.
Jeannie?
I think it was pretty much when he went to college that things were really out of control, became out of control for him. I think that he was accountable on the weekends when he was to come home at night. If he was going to spend the night at a friend's house, we called the friend's parents to verify. And I think even though there was probably experimentation then, I think it was once he went to college and he was on his own that he, probably partied more. And I think probably is when the addiction really grabbed him.
What moment did you realize he was using heroin?
Well, when he was going to Colorado, that's when he told us that what the problem was opiates that he was addicted to, and it was all pills at that point. But he told us the painkillers are opiates, and that's what heroin is. I don't think it ever became the form of heroin until the summer of 2012, when the Prescription Drug Action Committee made it harder for prescription pills to become available, and I think that's when it turned to the heroin form. Then is when he couldn't get his hands on the pain pills.
What was your reaction when he told you, as he said, I need to go to Colorado, that he had a serious problem? I mean, was it a surprise? What was your own personal
The fact that he was addicted to pain pills, yes, that was a surprise. We thought it was the alcohol. We thought it was probably the pot. Any risky behaviors were a concern to me. But yeah, I was shocked about that. We knew that he had been staying out late after work and coming in, late, and so the whole addiction to the opiates was a shock to us. We were concerned about some of his partying ways, but we were shocked about the opiates.
What about you, Donald? What was going through your mind when he finally said, hey?
Well, first of all, when he said he was willing to go to Colorado and he wanted to seek help, I thought that was a positive step. I was glad that he wanted to do something to get himself back on. How serious his problem was, I wasn't 100% sure. I knew he had a problem, and he admitted he had a problem. So I was optimistic when he decided he wanted to go to Colorado and get some help.
By the way, I have to ask this. Did you have any sense, or did you, in your thinking, your own mind, that as parents, that somehow you had went wrong, or was there anything that you could have done? I mean, well, Jeannie, what do you...
I had a lot of guilt for a long time, but it took me until Courtney talked me into going to an Al-Anon meeting. Tyler, the whole entire time that this was going on, Tyler kept saying, it's not your fault. And we used to say, even if we forgot to tell our kids something along the way, we live by example. And I think what it took me until probably about October of 2012, right before his relapse and we lost him, was to realize that it truly is a disease. And he truly was a good person. This disease caused him to have some behaviors at the end that he was not proud of. He stole some money from us. He stole some jewelry from us. He was devastated by that. But the disease part comes in, that these aren't bad people trying to be good. They're sick people trying to get well.
Courtney, I want to turn to you. What was your sense about what was going on as this unfolded? I mean, were you surprised at his problem, or what?
Yeah, like when we were kids, when like teenagers, I kind of knew he was trying some things, and I just figured it was, teenager things. And I remember my mom being really worried about it, and I thought she was overreacting. And so, you know, I kind of tried to not know as much as I could because I didn't want, like, I was like, well, you know, I don't want all this, like, pressure on me about things. So I tried to know as little as I could. You know, I thought that when he came back from Colorado that, excuse me, I thought that he was better and fine and we could go and be normal and, you know, do things together, and that was not the case.
Donald, so he comes back from Colorado, but then there are these relapses. Did you get a sense that there was now a downward spiral, or was there a continuing sort of sense of hope or optimism that maybe this time you turn the corner?
Well, you're always hoping for that, and it's something you live with all your life, I'm afraid. He came to the beach and relapsed, and when he came back, he decided to go to a methadone clinic, and that was his way of trying to get well. The whole time that your son is there, your values of getting a job, being a good citizen, having your benefits, all those things you're thinking about, and the reality is they don't mean a thing. What really means something is getting well and getting yourself back together, and that was a hard thing for me to realize. I was very, very encouraged when he went to methadone. He got a job at a local bank. The people that he worked with loved him. He was doing great, selling. He had the most credit people buying credit cards from him, and people would ask for him when they came into the bank. He spent 7 months using the methadone and working very well. We then found out that not only was he addicted to methadone, he was also addicted to the heroin. Both of those things, and there were not a lot of places to detox that would detox both. We did find a place in Florida, and that was costly at $1,000 a day. He spent 11 days there and then went to a rehab. And he wanted to be rid of both the methadone and the heroin. Methadone is used as a medical treatment, and I guess it's successful for some, but it didn't work for him.
So when did you find out that, or how did you find out that it didn't work, that he had passed away?
Well, it was, we got a call from my daughter, my other daughter, that someone had told her that Tyler was in the hospital. He had been taken there at 11 o'clock in the morning. He was in a motel when they found him. And they really didn't do anything to contact us, but the person recognized him and called my daughter, and she called me. When we went to the hospital, the doctor said his brain has stopped working. He won't make it through the night. He actually made it for 3 days, and we had an opportunity to say goodbye, and a lot of people came and did the same thing. He also donated his organs to several people.
Yeah, now obviously there's this sense of loss, but for the two of you, you turned around and said, okay, we're going to do something about this. How did that happen? I mean, give me some sense about what the aftermath was like and how you came to this, because a lot of people would have just given up or moved on or whatever. I mean, what?
Well, as he was laying there, brain dead, I spoke to Jeannie's dad and said, I think I'm going to take some pictures. He was on life support, and maybe I can take this into some schools and show them what this looks like and what can happen. I work in a school, and Jeannie and Courtney both work in schools, and we thought maybe the education of you try to make some sense out of your child's passing. And you want to find some kind of value and some kind of reason, and it carries up and stirs up emotions very often. But I think it's worth what we're doing to give some support to his life.
Jeannie, what about you?
Well, Tyler was not proud of this. He didn't want us to talk about it. He had a lot of shame, and we lived it. This was a secret in our life. because we respected that. And then I think what we learned while he was at rehab was we needed to start talking about it. But at the same time, there's the discrimination, and he needs to move forward in his life and have a job and do all those things without sabotaging that. So when he did not survive his first overdose, we decided we need to start talking about it. And we felt like that his life took this path for some reason. And with Don being the head of a school and Courtney having 8th graders, teaching 8th graders, we felt that this was the reason that maybe we needed to start talking about it. And since we started talking about it, Don named the group AtTAck Addiction. Tyler's initials are TAK, Tyler Armstrong Keister. And we probably have about 60 people who, all affected by the same problem, have come together, and the power of strength to get us all through. And I think only because of those people are we able to do what we're doing. It's all of them supporting us, and together we support each other.
Courtney, I know it's difficult. I was curious about your involvement in the group, because I noticed as I went through the list of board members, there was your name and your picture,
Yeah.
so you obviously feel very strongly about this. And you indicated a moment ago that during the addiction, it was sort of like you didn't really want to know. I mean, it was sort of like a protection. How did that change? I mean, what you're now fairly prominent in the sense, at least, that you're out there as a member of this group.
Yeah. Well, it's definitely been a very big part of my healing process, knowing that something better is coming from our tragedy. Sorry, I can't keep it together. But so it's been very healing to do things, and not just to sit back and wallow in our sadness, and just knowing that we can be there for others who are going through these similar things. Some people aren't ready to talk about their families or their own addiction issues, but our first meeting, people who were there and were addicts said, we don't want to be anonymous anymore. We want to have a voice and a face to it. So we aren't anonymous, and I just have noticed there's so many people that are affected by this, and so many that tell us what of help this has been to them. It's also helped giving me some direction as I am working on a dissertation, and I realize that this is where my focus needs to be, and so hoping to continue to learn and make changes from where we are now.
So, I mean, one of the things, by the way, you mentioned a moment ago, Donald, is that he was on methadone for a while, and he became addicted to that. And one of the things, I was reading some of the literature, and there are obviously people who think at least this at least provides some kind of outlet. Some suggest, by the way, it may be more of a public safety issue rather than necessarily getting off of drugs altogether. I think one person said that they could actually be on from 18 months to eternity. I mean, so what, as someone was taking this drug methadone, did you see an improvement? What was your sense about? I mean, obviously, in the end, it didn't work, but
Methadone has been around for a long time, and it's been a substitute for the opiate. I think it's a method that we have for medical treatment, a method that is used right now by a number of organizations, and has been successful for some. I think the key here is that when you use methadone, you have to be counseled. They have to observe how much you're using, and I guess it was fairly easy to increase the dosages, to talk the suppliers into increasing that. And I think the counseling and working along with the methadone would be what's needed, and I'm not sure that occurs all the time. Another one is Suboxone that people use as a medical treatment, and they're tools that organizations have to use, and I guess for some they've been successful, but I think they certainly do need to be monitored maybe a little more closely than they currently are.
By the way, now, as I was reading, a lot of the problems, particularly in Delaware, has been just that there's not a lot of facilities, and whether it's the state, that kind of thing. Were you surprised at that, especially given that there are a large number of people who are affected, certainly family members and friends, and that the death rate and the usage seems to be going up? It's
true, and that's something that the state is working on. There's one detox facility in the whole state. People from Sussex County may go, excuse me, may go up there and get turned away because they're full. I think they have around 50 beds. 26 of them are assigned to the state that they can use for people that may not have insurance. But obviously, the one detox place is not sufficient, and they are working on some more. In addition, there's no detox facility for minors. You have to be over 18 to go to that facility. So there's counseling groups that deal with juveniles, but there's not a detox facility in the state of Delaware for the minors.
Why wouldn't there be? Or is there like other avenues? Why is that, do you think? You guys have been, yeah.
Well, I know when we were going through this with Tyler, we didn't know. 19 months ago, we knew nobody. We knew one other family who had a child in this situation. We knew nobody, and I found it amazing that how many people are connected. We had a 5K. We had 900 people on March 1st show up for a 5K race. The worst winter ever. We had more than 700 pre-register. But I think that the state probably knew about it, but the public wasn't talking about it. The state and DHSS, they are very well aware of what the problem is, and they are working very hard on making changes. And I think it used to be treated more as a criminal aspect, where now they're recognizing the medical aspect first. And they're working hard on making a difference. And it's not going to happen overnight. It's very frustrating because there's nothing more desperate than trying to get the person that you care about help when they need help, and then they're willing to take the help. But they are working on making a plan. It's complicated with insurance. It's complicated with Medicare, Medicaid. But they're working hard on making a difference.
But what about the cost? You indicated a moment ago that you could send somebody down to Florida, but it's like $1,000 or whatever. What about the cost of trying to get a son or a daughter or a spouse or whomever into this? Is it just simply prohibitive, or is there ways around that? What do you?
Well, I guess that depends on your insurance and how that is. Of course, there's a parity in the Obama new health care that is supposed to be a parity with mental health and addiction, similar to any other disease. And I'm not sure that that's kicked in yet, but we have met with some insurance companies. They're going to consider it similar and treat it the same way. Not only was it expensive to send him there, but it was the only place we could find that would detox him on the methadone and the heroin. So the facilities are hard to find. They're expensive. There's a facility in anyone you go to, it's it's $20,000 to $40,000 a month to have someone in there. Now, some insurances will cover a bit of it. When Tyler finished his 11 days detoxing, he went to a rehab that was in Florida, and insurance picked up all but a couple $1,000s of that 30-day stay. So it varies on your insurance. It varies on where you are and where you send them, and what your specific needs might be.
So when you were faced with that, was particularly the kind of numbers you were talking about, were you taken aback when you realized that this could cost a lot of money? And asking yourself, do I have the resources, or how I can get the resources? I can imagine a family of modest means who might be facing this. They may or may not have insurance. What do they do?
Yeah, there is help for them.
Yeah.
There is help for them, and those that don't have insurance. In fact, sometimes when you go to these facilities, you may be better off without insurance if the state or someone Medicaid can help you out. So it just varies from location to location and place to place, and it is difficult. I was fortunate. It strapped us a bit to spend that kind of money, but I think it was something we needed to do in this case.
And one of the things I find frustrating is Tyler had a full-time job with the bank. He had Blue Cross Blue Shield on his own. He was 24, so he was still covered under my Blue Cross Blue Shield through the state of Delaware. And he, like Don said, we paid for the 11, 12 days for his detox. And then he went to the rehab. When he finished rehab, he felt like he needed more time. But he was denied services because he had just had his first and only 30-day rehab. Well, we keep getting a bill well, we keep getting a statement, it's not a bill, from Blue Cross Blue Shield about his 4-day stay in the hospital when he was on life support. It took a few days for him to be declared brain dead, but that bill was a heck of a lot more than it would have cost for them to send him to another 30 days worth of rehab, which might have been the 30 days that he needed. So I find that to be frustrating, but...
Courtney, you indicated you're doing some of your academic work on this. Tell me a little bit about that.
I certainly have found a passion with this a lot. So I am right now. I'm in the process of researching a lot of background information on addiction and drugs and the ways it affects the brain and. I'm definitely still in the early stages, but, my outcome of my research is really going to be looking at people's perceptions of our group. So, I think that'll be really powerful to know what others think of us so that we can continue to head in the right direction with our group and be as helpful as we can to as many people as possible.
Yeah, because I know that, for instance, there is I alluded this a moment ago that there is a sense or an image of someone who's a junkie. I mean, we see these images all the time on police shows and attorney shows and so on. And yet, as I read it, I mean, most actually are white suburbanite, often middle class. I mean, have you found that's the case?
Yeah, it's certainly. Very much affecting the middle class. I know middle-aged women are, and as well as the elderly, are also very affected by it. And it's not. You wouldn't think that. You think it's. We all know what the stereotype is that you think, and I know that one woman in our group collects obituaries from the paper of people that, she can read the obituary and kind of tell that, oh, okay, this was a drug overdose. And it's mostly the young people that she's collecting for because it doesn't register. If someone who is older passes away, there's many of reasons that why this could be compared to younger people, if they pass suddenly, but it is affecting them as well.
Because once I ran across is that there are some children that begin using heroin as early as the age of 12. Mm-hmm. I mean, that seemed really, really, really early.
Yeah.
I mean,
it's scary how early that can be, and a lot of kids. I would say if you're using heroin at the age of 12, it's some sort of self-medication. You're taught in school, everyone knows that heroin is bad. There's steps that you do before you take heroin. Heroin is that last resort.
I mean, and in our society, heroin is like the big drug that everybody's, you may do lots of things, but this is like the wrong thing, and yet we see this rise. I mean, obviously, as we indicated, it's cheaper, but that stigma of just the drug itself is just it's not enough to keep.
Yeah, well, the problem is that, I think the medical field, we really need to look deeper into that because the opiates are made of the same exact chemicals and things that the heroin is made from. So, you think, oh, a doctor is prescribing this to me, this is safe to take, or a doctor prescribed this to someone else, and, well, a doctor says it's okay, but, people really need to be aware of the consequences. I know that I was given opiates when I had my wisdom teeth removed, just like many people do. And, my mom already was very aware of a lot of things since, she was dealing and very worried about, my brother in this case. And she was like, well, you should try and stop taking them as soon as you can. So I didn't finish my prescription of them. And, and because she was in my ear about it, which is good, but I know that the doctors will prescribe 30 days worth of pain medication to people that don't need 30 days. I read something the other day that the pain medicine that is sitting in people's cabinets is enough for, the entire nation to be on pain meds for, I forget how long it was, but, people hold on to this, oh, well, maybe I'll need it for this or that, and, it is the precursor to heroin because it's made up of the same things. I think that people need to think twice, even if they are prescribed it, about using it. And I think that when people have it in their medicine cabinets, they need to figure out a way to safely dispose of it as soon as possible, because that's where kids are getting it from. People go into open houses and look for it that way too. And there are, I think, at least twice in Delaware a year ways that you can dispose safely of it. They have drug take-back days.
By the way, do these? Is this a situation where the kids get into, say, for instance, the sort of the medicine cabinet, or is this also a problem where people are prescribed these things and then they just sort of go? I mean, what's?
And Tyler had his
Both.
wisdom
Both?
teeth taken out during that freshman year at college, and I didn't know it at the time. But when we went back, they asked him. What I didn't know was they had already given him a prescription for pain medicine, because he was having discomfort, and that's when he realized he needed his wisdom teeth out. So when we went back, the nurse asked him, "Are you still having discomfort?" And he said, "Yeah." And she did give him another 30 days. And I found that to be alarming. And we've always been the type that we don't take anything unless we absolutely need something. There's other ways of dealing with things, in my opinion, but that's just my opinion. So I think that the state of Delaware is educating the doctors. There's a prescription drug action committee led by Dr. Rattay and Dr. Rattan, and that has been a huge game changer in the prescription drugs. Unfortunately, what happened, and I think that our kids, Tyler included, they started experimenting with these pills, having no idea when they started that it was an opiate and what was going to become of it. But now, because they've taken hold of limiting the prescription drugs, that's the heroin spike.
These drugs are actually more powerful than heroin.
Yeah.
Fentanyl, for example, when you hear about the fentanyl-laced, there were 11 deaths with fentanyl-laced heroin in Delaware. It is many times more powerful than heroin itself. So if you don't have the fentanyl or the pain pills, you need to go to that. And people get in automobile accidents, get these pain pills, and become addicted. And they don't choose that. It kind of chooses them.
It seems to me that this particular rise, particularly overdose and heroin use, has caught state officials by surprise. I mean, certainly here in Maryland, there's a surprise at how quickly we've had a stat just a moment ago, 33% increase in drug overdose, right? And much of that related to heroin and the fentanyl that you described. Clearly, there was not an anticipation when they decided to crack down on the prescription drugs in Delaware that there would be some alternative. I mean, is the sense you get that the state officials were surprised, and how satisfied are you that they're reacting quickly enough?
Well, I'm not so sure that they were surprised. I think since 2009, in the state of Delaware, overdose have surpassed automobile deaths. And from 2009, I think they were aware that this issue was coming. I don't think there's been any major changes in the last 10 to 20 years as far as supplying places for young people to become, or addicts to become, get some help and rehab. So I think they're reacting now. It's slow to react. The wheels turn slowly, but I think they're making steps. And I think we're fortunate that that we have been able to partner with them in trying to move this issue and get some action.
Well, finally, I wanted to ask you, there was a great war on drugs. A lot of people were sent to prison. Your son didn't have to be. But there seems to be now a shifting or changing of thinking about sending people to jail for drug possession. Are you optimistic that some kinds of major changes are going to be created, that the society is looking at this much differently than, say, they did when Nixon was president and they were talking about the war on drugs?
Yeah, I think Secretary Rita Langworth invited us to help her organize a forum that she was going to have with the top officials in the state. Senator Rob Koop, who heads the prisons, was there. Judges, doctors. It was three-part: education, criminal, and medical. So I actually sat at the criminal justice table with Commissioner Koop, Corporal Setting from the county police, one of the judges from Kent County, and they all recognize that this needs to be treated medically. they're trying to work out how they're going to make this shift. And they do have a CREST and a KEY program in the state, which is for people who have become addicted and have crimes committed because of their addiction. And they're working on rehabilitating them, and they may be in there for a year. So they are doing an intensive program for those people who are addicted. But they're very well aware of it. Mrs. Markell, Governor Markell's wife, tells her story often of her mother and father, who her mother became a recovering addict. Her father never did, but she talked about how it affected her life and how this is her passion to make a difference. And they are very compassionate to our calls, and they're listening. They're listening. It's like Courtney said, it's your common middle of the road suburban families that are sitting here and they're paying attention to what everybody has to say.
We were speaking with Donald Keister and his wife Jeannie, as well as their daughter Courtney. They are founder of the group AtTAck Addiction, and they lost their son Tyler in 2012 at the age of 24 to a heroin overdose. And we appreciate you stopping by, and certainly our condolences.
Thank you.
This has been Delmarva Today. I'm Don Rush, and thanks for listening.
This has been Delmarva Today, a production of Delmarva Public Radio. Chris Rank produces and is our audio engineer. Don Rush is your host. For podcasts, visit our website, delmarvapublicradio.net, or subscribe to the Delmarva Today podcast in iTunes. Delmarva Today can now be seen on PAC 14. To view the schedule, visit the Daily Times or visit pac14.org.